Okay, a lot has changed since the last time we talked. COVID is around and about and everywhere. Some things are getting ready to happen though here in Maine. We're going to open up some procedures that we feel are more urgent, secondary to the fact that cancer waits on no one. If you've been diagnosed with cancer and it's time for your screening, people really want to get that done, and you might be able to wait 4 weeks, 5 weeks, but once you start waiting, months at a time, the tumor progression is very, very real. So we want to get that opened up so we can give those people peace of mind or get the lesions early. So with that in mind, we're opening up this week. There'll be a few changes. One of those changes is that you have to have a COVID-19 test 48 hours prior to the procedure, and that's going to be at the walk-in clinic, Dr. Hottentot's old office at Inland, or in the Inland facility itself. So this is all going to be a little bit new as we get the details easier to understand and digest. It tends to be an inconvenience. Some of my patients live over 3 hours away. However, we might be able to do it the morning of, and then we have to maybe wait 45 minutes to an hour, and we could get the test, and maybe we could do it that way too. So it's a work in progress, but at least we're up and going. As far as an update on COVID-19, you probably know as much as I do. It seems the new antiviral drug that originally was used for Ebola, remdesivir, is showing some promise of shortening the viral shedding and the duration of the disease. There's been a lot of work with the blood plasma transfusions for the antibodies. That seems to be promising. Some of the earlier studies have been somewhat debunked concerning hydroxychloroquine or chloroquine. However, there's other studies that are ongoing, so that still remains to be whether that's going to be of use or not of use. The last thing I'd like to say is that the big cities probably need to really stay shut down, in my opinion, for a little bit longer. It seems like they kind of have trends where things go up and go down and go up and go down. We're fortunate here in rural Maine. We have one of the lowest incidences of COVID-19 in the country. I'm also proud of my hometown county, Ellis County, Oklahoma, where they have 0 cases. So as things start to open back up in the rural areas, it's important that the people in the city areas stay put, because that's where the disease mainly is manifesting itself. And so I know everybody wants to get to Maine and get to their vacation home and have fun here, but our incidence rate is really low, and we don't want to see that change until it's safe to open up. With that said, I hope everybody stays healthy and relaxed, and let's go out there and prevent some cancer.